So now in circle of Willis we'll discuss in diagrammatically in the Visram Singh textbook. This is the arch of aorta. Arch of aorta, right side it give a branch, brachiocephalic trunk. Left side direct branch from the common carotid artery, subclavian artery. But whereas right side it is divided into two parts, common carotid, subclavian artery. So circle of Willis is mainly formed by the vertebral arteries, two vertebral arteries, two internal carotid arteries. For that, from where it is coming, this vertebral artery? See here, vertebral artery, it is a branch of the first part of the subclavian artery in the left side. At the same time, vertebral artery in the right side, it is a branch from the subclavian artery first branch. These two are passing through the foramens, that is the transverse foramens of the cervical vertebra. Through that, up to reach to the atlas, then crossing above the superior surface of the atlas, then enter into the foramen magnum here, foramen magnum. After entering through this foramen magnum, these two vertebral arteries unite together to form a large artery. This is called the basilar artery. So this junction where it is union is there, exactly where is the junction of the pons and medulla oblongata, inferior part of the pons, superior part of the medulla oblongata. At that junction, these two arteries are united together. Then after, these two are this basilar artery give a terminal branches. These are the posterior cerebral arteries. Posterior cerebral. This is half of the circle of Willis. Next, another one, internal carotid arteries. These are the internal. See here, this internal carotid artery from the left side, direct branch. This is branch of the common carotid. Direct branch from the arch of aorta left side. But whereas this is a branch from this, that is a brachiocephalic trunk. So this common carotid passing through the neck region at the level of the thyroid cartilage, it is divided into external carotid artery, internal carotid artery. This internal carotid artery cannot give any branch in the neck region. Then after this internal carotid passing through the carotid canal, then it will enter into the middle cranial fossa, just lateral to the body of the sphenoid bone. It is going towards the anterior clinoid process. Here it is give mainly three branches. One is the middle cerebral artery. See here, middle cerebral artery. This side also middle cerebral artery. This is the anterior cerebral arteries, right side and left side anterior. These two are communicated by the anterior communicating branch. So this, and also here posterior communicating artery is there. So this posterior communicating is a branch of the internal carotid artery communicating with the terminal branches of base of the basilar artery. So now it make a circle around the base of the brain, exactly around the interpedunclar fossa region. Interpedunclar fossa. In center we can also see in the base of the brain region mammillary bodies, tuberculum cinereum of the pituitary gland also visible in the base of the brain. I can show that in the specimen. See in this another diagram. So these two are the vertebral arteries. These vertebral arteries gives branches. See here, anterior spinal arteries, posterior spinal arteries. These two spinal arteries going to supplies to the spinal cord. So these vertebral arteries give branches to supplies to the spinal cord, as well as it is going to give a branch inferior cerebellar artery. Also gives to branch to supply the cerebellum, and also it give a branches to supply to the medulla oblongata. So vertebral arteries gives three branches, that those are going to supplies to the spinal cord, medulla oblongata, as well as in posterior inferior cerebellar artery. So lower half of the cerebellum also supplied by the vertebral artery branches. These are the branches of the vertebral. After union of these two, this is the basilar artery gives branches. See here, this is the anterior inferior cerebellar artery, labyrinthine artery, pontine arteries. This is the superior cerebellar artery. So and also terminate branches. These are called the posterior cerebral arteries. So basilar artery is going to supplies to the pons, labyrinthine part of the inner ear, as well as the anterior cerebellar artery. Next to terminal branches, posterior cerebral artery. It going to supplies to the cerebellum, pons, midbrain, and superior and middle part of the cerebellum. Next, and the terminal branches, posterior cerebral arteries, going to supplies to the posterior lobe, means occipital lobe of the cerebrum. So up to this is the basilar part. Next here, the internal carotid artery, it give a 5 branches. One is the middle cerebral artery, the largest branch of the internal carotid artery. It is enter into the lateral sulcus of the cerebrum. It give a branches. Maximum 80% of the blood supply to the supralateral surface of the cerebrum. This is the ophthalmic artery. This is passing through the optic canal. It going to supplies to the eyeball. This is the anterior choroidal artery. This branch going enter into the lateral ventricle, supplies to the makes the choroid plexus that produce the CSF. Next, this is the posterior communicating artery. It communication with the internal carotid artery as well as the posterior terminal branch of the basilar arteries. These are the anterior cerebral arteries passing through the just in front of the optic chiasma. Just lift it, we can identify the anterior communicating arteries. These two, right and left, anastomosing like a communication by the anterior communicating artery. So now these are all, there is no gap between the blood vessels, make a circle. This first found by the willis, that's why we are calling the circle of willis. Where it is present? In the base of the brain. In the base of the brain where? In between the interpeduncular fossa. In the center we can identify the optic chiasma. In front of the optic chiasma, mammillary bodies as well as the tuberculum cinereum. Third ventricle coming from this area. If any clots, if any cuts of these blood vessels, blood is clot in front, in the center, that compress to the olfactory nerve. First, that is the third cranial nerve, oculomotor nerve. That's why the person, they lost the vision. So that's why everybody, so there is the anastomosing is there, very less, like acting like a end arteries, because how much that blood need the cerebrum, that much of the blood is not supplied by this anastomosing. That's why we are calling these are the end arteries. This is called the circle of willis. This may expected 5 mark question in the examination. If you know this diagram practice, we can easy to understand and easy to write the whole blood supply of the brain. So 3 parts: vertebral arteries branches, basilar artery branches, internal carotid artery branches. You make a notes. Next I will show in the specimen